As a new graduate nurse, I distinctly remember trying to Google how to chart better, how to chart, more effectively, and I didn't get anywhere. So I hope any new grads out there find anything that I'm about to say even a little helpful. I am definitely not the best charter in the world or even the best charter on my unit, but I do chart a couple of things pretty consistently. The first thing that I always chart whenever I have a patient is I always chart about their pain. And I specifically chart that I reinforce the numeric pain scale, which is the scale that we use to measure our patient's pain on our unit. I also talk about, what pharmacological and non-pharmacological interventions we have to help address the patient's pain. And this is something that I always chart on every single patient. This is important, especially, from a manager's perspective. I'm not a manager, but, if I were a manager, because of HCAHPS, if a manager is going to audit your chart, you want them to see that, yes, you are talking to the patient about their pain control and, everything about their pain. So that's something that I'm always very consistent about charting. Another thing that I'm pretty good about charting, and I don't see a lot of other nurses using this phrase, is helping to promote maternal comfort. So anytime I put a pillow behind a patient's back or reposition a patient or dim the lights, I will always chart, place pillow behind patient's back to help promote maternal comfort, or, decrease stimulation and decrease light to help promote maternal comfort. And I do this because I do care about the patient's comfort, and we are all doing these things. If the patient asks for another pillow, we're giving her another pillow. If all the time we're doing these small things, and I think a lot of times we're not charting it, and we're not charting why we're doing it. So, sometimes we reposition a patient for other reasons, but a lot of times we're repositioning them, so that they'll be more comfortable. And I always try to chart this and to use that phrase. And I specifically use that phrase because if anybody is going to audit or look at, my charting and look at the care I'm giving, I want them to see that I cared about the patient's comfort. I don't want, if I were dragged into court, I don't want anyone to try to say or to try to make it look like I didn't care about how the patient felt, or, or anything like that. So I always try to use that phrase. Another thing that my favorite charge nurse once told me to do, and this is something that I always have to work on, is to chart in the patient's room. So anytime you do anything, just if you have a computer at the bedside, use it. Chart in the room instead of leaving and waiting until later to try to remember, oh, what time did I do that? I did it before I did this, but after I did this, and just trying to pin it in somewhere. So, okay, my dishes are ready to be put up. But anyway, so that's something that I always try to do too, is to chart in the patient's room. But that's something that I always have to work on. And I hope that you found any of this helpful.